Hello, I am Dr. Shishir Joshi. I am working as a physician in Sahyadri group of hospitals. Today, the point of discussion or the main point of discussion is monkeypox. Basically, this is a new type, or this is a old type of disease which is coming to Asian countries, which was previously only known in African countries. Because of the rampantness or because of its spread in Asian countries, we are doing these videos for the awareness of the people, and we should know about this disease in detail. So in this video, I am going to tell you about the etiology, about the problems, and about the treatment of this video. Now, the epidemiology or the cause is Mpox virus is nothing like, it is similar like a smallpox virus. It is from the same family, variola family, and Orthopoxvirus. Unlike smallpox, it was eradicated in 80s, 1980 maybe, in 80s. It is eradicated because of the rampantness of the disease. It was investigated, and there was a huge number of researches were done on smallpox. But for Mpox virus, since it is a zoonotic virus, because that virus spreads from the animals. Since it is zoonotic nature, the spread of the virus was previously between the animals mainly, and infected animals and people who are staying with the animals. So previously it was in African countries mainly. There are two types of strains in Central Africa and in Western Africa. There were two type of strains. The Central African strain was slightly more serious or more severe type of, and the Western. So that disease was previously diagnosed and was spreading in the African countries because of its zoonotic nature and infected animals. And for humans, those who are staying with the animals, they get this infection from the various type of like salivary secretions, then very different type of body fluids, and infected animals. So the spread is mainly zoonotic and through the infected animals. Now about the transmission of the disease, as I told you, the mainly this infected animals, body fluid, then salivary fluids, and the skin lesions of the infected animals. These type of fluids, they tend to transmit this disease to humans. As I told you, because of this transmission, mainly the transmitter, mainly the animals are the rodents, and the rodents, this African squirrels, they are the main they are the main part of this transmission of the infection. About the transmission, when it gets transmitted to the human, the similar problems starts occurring in humans, mainly the skin lesions, mainly the fever type of, and the infection type of. Now once it gets infected to a single human being, the human being itself transfer that disease to another human being, because of the again the transmitter is the same, the human being with infected body fluids, infected the chest infections, and skin infections. Mostly these droplets from infected human being to another human being, it gets transmitted easily, and the transmission is between day 1 to day 21. So the transmission phase is from day 1 to day 21. So the transmission, as I told you, started with since it is a zoonotic disease, that gets transmitted to infected body fluids, infected skin lesions, and infected animals. Through them, it goes to human being, and from human being to another human being is by mainly droplet infections. So the transmission is like from human to human, that is droplet infection, and second is skin infection because of infected skin lesions gets transmitted to another human being. And the last one is vertical transmission. That means sometimes these infections get carried from mother to child. Now, about the disease, or maybe clinical presentation of the disease. The disease, the clinical presentation, that incubation period and infective phase, that starts between day 1 to day 21. Now, there are two mainly phases in that infective clinical presentation. One is mainly basic phase, where the patient starts complaining of myalgia, low grade fever, and respiratory sometimes of infections. And typical of a patient who comes to us like a viral infection, these patients also presents the same like a similar symptoms like a viral infection, but from day 1 to day 5. But after day 5, they start getting eruptive phase. That is eruptive phase. Because of that viral infection, patient starts getting eruptions on the body, maybe in the small quantity or maybe the large. The size of the pustules are different. So there is a two mainly phases in prodromal phase. That means where the infection starts from day 1 to day 5. Between that, patient suffer from fever, myalgia, body ache. And the second phase, where after day 5, that patient gets infection, and there are many skin lesions on the body. So mainly in prodromal phase, where patient gets first time present with simple viral infection, there are many patients who present with a small glands. Maybe there are these are known as lymph nodes on the body. So they starts with low grade fever and lymphadenopathy, and after that the eruptive phase. Now, there why this mpox virus is, we are very concerned about the treatment and the seriousness, because that infection is not like a simple viral infection and it gets erupted or it gets out of the body within next maybe 5 days or 10 days. This phase from day 1 to day 21 is like a in eruptive phase. There are not only skin lesions, but this viral infection gets to the in the body also, and there are n number of complications in body. Like it starts with simple upper respiratory tract infection. It goes to lower respiratory tract with bilateral pneumonitis, and patient gets breathlessness, and some patients need ventilator also. So ventilatory assistance, and after that many complications like kidney involvement or heart involvement. Most of the patients, those who are pregnant females, they are very prone to get all complications in the body because of mpox virus. As I told you, many of the time pregnant females get more infections, and the commonest commonest complication of this mpox virus is encephalitis. That means there is a swelling in the brain, and because of that, the functioning of the brain is not adequate. Because of that, patient gets convulsions and they need a ventilative support. So there are n number of complications because of mpox virus, and which is happening to each and every organ of the body. So now, if you ask me what about how to diagnose it? See, any person traveling to a different type of area in the world, like if a person traveling to African countries, Central Africa, Western Africa, and there is a typical history of that patient staying with animals, or that uh, patient is he is exposed to infected animals. These patients are, so we should identify these patients. They need a treatment and they need a diagnosis. So about the diagnosis, there is a how we diagnose. Like any viral infection, we do a PCR test, polymerase chain reaction PCR test. So similarly, for mpox also there is a PCR test, and that from that PCR test we can identify this is a typically mpox viral type of infection, and we need to identify it early so that we can keep that patient as an isolated patient. Now, coming to the treatment part of it, the treatment part is any type of viral infection. If you see in the in our country, we have to treat them symptomatically. That means if a patient coming to us for urticaria, for upper respiratory tract infection, or for simple sinusitis, we need to support. We need a supportive treatment. Similar thing in Mpox also. There is not a sir written treatment for it that we need to give this type of medicine for Mpox. No, there is nothing like a prescribed medicine or prescribed treatment for it. But we need to do a proper treatment like symptomatic treatment for each and everything, for respiratory tract infections, for complications of it, for skin infections, for skin eruptions, and the infections coming because of skin eruption. So there is a typical, we need to give antibacterial, antiviral drugs and supportive medicines, and to reduce the fever, antipyretic drugs, and to reduce urticaria and maintain the adequate hydration of the patient. And the last thing is to avoid water complications happening to the body, including infections and including damages to the body parts. So as I told you previously, these are all the Mpox virus type of Mpox virus and its complications. So to conclude this session, I want to tell you, if you find any person who is traveling from that typical area, or who is suffering from this type of infections, or just try to educate him, take him to the hospital, take him to the physician, to infection specialist, and try to identify it, try to get early diagnosis. And if you get early diagnosis, keep him isolated so that that infection doesn't spread to any other person. Thank you very much.